remains the target of the government, and the record 88 lakh plus vaccinations that took place on Monday was a push in that direction. Sustaining that momentum going forward will depend on availability of vaccines and the effort put in by states. It also requires a big push in rural areas and among those who are not so digitally savvy, and for this we need more involvement from corporates and civil society. To talk more about this, we're now joined by the CEO of Medanta Hospital, Pankaj Sahni. Medanta has been holding a vaccine camps in villages and smaller colonies in and around Gurugram. So, Pankaj, if you would tell us what prompted you to organize these camps, and what was the thought that went into it?
Thank you very much, Gargi, for having me on the show. The basic thought was that everybody deserves an equal access to vaccines. And it was our belief at Medanta that it is our responsibility as much as it is anybody else's to assist with this vaccination drive. One basic philosophy of ours has always been to try to give healthcare access to as many members of the community as possible. So this was part of our DNA, part of our original thought process. The second thing is that, look, this virus is such that nobody is safe until everybody is vaccinated. And so it's very easy for people to isolate themselves mentally into certain bubbles and say, well, I'm vaccinated, or my friends are vaccinated, or my social circle is vaccinated. But the virus doesn't believe in any of this. So the virus doesn't differentiate between the rich and the poor. The virus doesn't differentiate between those people who have certain accesses and those who don't. And so it is important for us as a nation, and indeed across the world, to vaccinate as many people as possible. So we didn't really think twice about this. We just went ahead and started. And we are very happy that the local government in Gurgaon supported us. Other governments in locations where we have facilities are very keen. And so we just did it. It really wasn't much thought.
And what was the experience like for your medical staff? If you could tell us some of the challenges they encountered, was there a lot of hesitancy? Did they need to counsel people?
So actually, we were pleasantly surprised. The demand was huge. We had, in our vaccination clinics, we had lines starting at 7 o'clock in the morning, even though the vaccination camps were actually starting a couple of hours later. We tied up with local NGOs to help with information and awareness campaigns. We haven't actually seen the same kind of vaccine hesitancy that you're hearing about in some of the rural communities. But we did have medical personnel on board. We sent a team, doctors, nurses, patient care staff to actually assist with any queries that people may have. I think by and large, though, at least in the Gurgaon area, we found that the administration has done a good job of building awareness. We are very happy that media outlets like yourselves are actually helping promote the awareness. And while there is some concern specifically with access, and so the digital divide challenges, people not being able to access smartphones, etc. And so that's why we wanted to go out into the villages. So we have done all of our camps really in the areas where people have the least amount of access, where people haven't been able to come out. We've been doing with rag pickers, with local laborers, with construction workers, and really going into the communities where they live, where they work, and trying to access them there. And by and large, we've seen a very positive response, and I'm very grateful to our teams as well as to the partners that have supported us in doing this.
And when you talk about the digital divide, if you could tell us a bit about that, because we've been speaking about that a lot, and it's a big challenge now that you're allowed walk-ins of those above 18 years of age. Has that made the whole process a lot easier?
It has made the process easier, and I think that while many of us across the country are fairly savvy with mobile phones, there is still a section of society that is not so comfortable with using it, or maybe the access is not so clear. Language may be another issue. And so I think what we've been able to do is put people on the ground who will help actually with the registration. So if a patient walks in, doesn't know how to do registration on the CoWIN app, we assist them. It's also not just a function of economics. There are certain age groups. There may be certain people who are less digitally or technologically savvy that feel that they won't be able to get this done. And so we've been reaching out to them. We also find that there are certain groups which are not very sure whether it's really required. So there is some hesitancy, like I've already had COVID, do I still need to have the vaccination? And so building awareness around that, or that I've had one vaccination and they don't realize that they actually need to come in for the second vaccination. So I think all of this stuff needs to be put together, whether it's the digital access, whether it's economic access and whether it's informational access. And that's what we've been trying to bridge, is actually go out into the communities, help people actually address all of these three concerns.
And are you planning to hold more such camps in other parts of the country?
Absolutely. So we've already started camps such as this in Jharkhand, where we have a facility. We will be starting in UP, in Madhya Pradesh, as well as in Bihar, Delhi, and of course Haryana we've already been doing. So we will be doing these camps in all the areas where we have our facilities. But more than that, we've already started camps in parts of Rajasthan. We have demands for doing this in parts of Patna. So I think it's our responsibility as healthcare providers to actually go out there into the communities, especially places where there may not be hospitals and clinics where patients could easily access vaccination centers. And so we are creating mobile centers, partnering with various corporates, various NGOs, various associations to hold vaccination camps on their premises, where our teams will come there for a couple of days and vaccinate people. So we're doing whatever we can, and we would be very happy to partner with anybody who would be willing to share the challenges and the burdens of doing this vaccination.
All right, and hopefully more big hospitals will also, conduct camps like this. Thank you so much, Pankaj Sahni, for joining us on the program.
Thank you very much.
With that, time for us to slip into a short break on the